Welcome. I'm Tom Wilson, a board-certified periodontist, and today I'm going to talk about implants and how to keep them healthy. We've been doing implants in our practice for years and years, and we've learned some things that are very important in the things that we should do to make implants succeed and the help that we need from you as the patient. And I'm going to go over some of those facts today. One of the things we're going to assume is that the implant has been placed correctly and it's been restored correctly. That means that the bone is solid around the implant and that the neck of the gum around the implant is healthy and free from infection, and that the restoration allows the patient, you, to clean the area. So what can go wrong here? What do you need to look out for? Well, there's several things that can create problems with implants. The first is infection. There are infections around implants just like there are around teeth. They're a little different in terms of looking at them under the microscope, but the genesis by and large is the same. And that's bacterial plaque. That's the stuff that causes periodontal disease, periodontitis, gingivitis, all of those bad things that we see on TV. Those infections, both around implants and around teeth, are started by bacteria found in the oral cavity. If you have your implant surface perfectly clean, within a very short period of time, bacteria become inculcated around the neck of the tooth. They just attach to the implant. If they stay there for more than a few hours, they set up an infection in the gum tissue around the implant itself. Now, it's important to understand that the gum tissue around an implant and the gum tissue around a tooth are different. And this is the important difference. The gum tissue, called gingiva, around a tooth actually attaches to the tooth surface itself. Soft tissue around an implant, which is called periimplant mucosa, just hugs tightly around the implant surface but doesn't actually attach to it. And that's going to become important, because what happens is that after the bacteria accumulate around your implant for a few hours, they go down and infect the gum tissue around the implant. And that gum tissue, once it becomes infected, begins to let loose. And that is going to allow bacteria to go below the gum and to affect the bone. And remember, bone is what holds in your implant. So it's very important to clean your implant surfaces on a daily basis and to remove the bacteria that can cause infections that may ultimately lead to problems around the implant. There are other things that can negatively affect your implant and its longevity. One is too much pressure, really simple. There's lots of us who clench our teeth, grind our teeth. It's very important that, especially on back implants, that bite surfaces go vertically on implants, not from side to side, because side to side pressure on back implants can be to the detriment in terms of the longevity of that implant. So oftentimes what do? We check the bite, take a piece of typewriter ribbon, put it between your teeth and implants, have you bite down and make sure that there's no negative forces that could create the horizontal conditions that we are concerned about. The other is, for the vast majority of our patients who have implants, we suggest a protective device. That protective device we call a bite guard. It could be called a parafunctional device, a habit device, all kinds of things. the type that we have found to be most protective over the last 50 years or so of our practice is a hard upper guard that actually covers all the surfaces of all the teeth. And you just wear it at night, hence the term night guard. The other thing that can create a problem in terms of your implant is the relative fit of the tooth or the bridge or the denture on top of the implant itself. There are two ways to attach a solid device to an implant. One is to cement it down, and one is to screw it down. Our studies done, 10, 15 years ago now, will show that cementation is usually not the preferred option to place a crown or a cap or a bridge on top of an implant. Because what we found was, over the long term, some of those small pieces of cement worked their way into the soft tissue, and years and years later we saw a problem with it. So in most cases, if we have a choice, we're going to say that it would be nice to have the crown, the cap, the bridge, whatever it is, screwed down to the implant. That's the best way. So what do you have to watch out for, and what does your dentist have to watch out for if you have a screw-down restoration? Well, sometimes that little screw comes loose. There are times when you can recognize it. There are times it takes a dentist or a health professional to find that problem. The point is, your implants need to be checked periodically. Just because you don't have teeth anymore doesn't mean that you can't have some of the same problems seen around teeth. So as we're going to discuss in a few minutes, maintenance therapy on a periodic basis is really important. So the next thing we want to talk about is, how do you take care of your implants on a daily basis? You should have access to all the surfaces of the implant body itself. If you don't, you need to see your dentist and get that space open so that you can clean. It may be floss, it may be a brush. In some extreme circumstances, it may be a water irrigating device. Now, the next question is, how frequently do you need to see your dentist? The answer to that is there's no perfect answer. In general terms, people who have fewer problems around their implants see their professionals less, maybe once every 6 months or a year. Those who have more problems, especially if you have periodontal disease around some remaining teeth, usually need to see a professional for a cleaning and evaluation about every 3 months. So, what happens at that evaluation? Well, one of the things that occurs is that you take a very thin device and you run it around the neck of the gum where it interfaces with the implant. And you look for something very simple. Is it bleeding? The other thing you do is you take your finger and you gently push on the gum tissue around it and make sure there's nothing coming out of there that shouldn't be. If there looks like there's signs of early disease, there's some very simple ways to clean the surface off, usually using a piece of gauze or a piece of cotton with some sterile saline in it, because you want to get that surface clean before the bacteria that have now infected the gum go into the bone. If you find that you want to see the patient back in about 30 days, do the same reevaluation, make sure that everything is okay. One of the things we found is that if you clean well, if the patient cleans well, and they have a cemented restoration and they come back in 30 days and they're still bleeding on probing, that means there's some excess cement underneath the tissue, and that excess cement needs to go away. So what happens if the infection goes from the gum to the bone? The bone begins to deteriorate, and you really don't know anything's going on, especially in the early stages, sometimes even in the later stages. If you catch early bone loss, it's very possible to get that area healthy and keep it healthy over a long period of time. But because this problem is pretty sneaky, you need to have it evaluated by the dentist because it's not going to hurt until pretty late in the game. So if you find a problem like that, what do you do about it? Well, the simplest thing we do, we have a very sophisticated camera. You can go down, you can look at the surface of the implant, you can clean it off, and you can, in most cases, regrow some of the bone that's been lost. So what are the keys here? The keys are, first of all, you need a well-placed, well-restored dental implant. Second is you need professional help from somebody that does implants a lot. And you need them to check periodically to see how the bite's doing, to make sure there's no infection, and to make sure that there's no extra pressure on the implants themselves. I hope this has been of some benefit, and I hope this helps a lot of people retain their implants for years and years and years. Thanks for watching.